All right, good evening, everyone. Dr. Stacy Holweger here. I am so excited that you have decided to join us, or maybe you're catching the replay. We have back with us again one of my all-time most amazing favorite doctors on the planet, Dr. Don Verhulst. He's a medical doctor. I have known Dr. Don for, right around 15 years now. I love seeing him present, share information on stage, and just be able to pour into everyone. And so I'm not going to share anything tonight. I want to be able to let Dr. Don have the field, the floor, the whole time, whatever it is, all of you guys, so you can hear his words of wisdom and knowledge and information about LifeWave's technology. So before I do read his bio, I want to make sure you understand I'm not a medical doctor, right? I'm PhD. He is a medical doctor, but he's not your medical doctor. So if you have questions in regards to your health, please check with your healthcare practitioner, your doctor, or whoever's in charge of you. And if you're pregnant, nursing, children, you're on medications, please know that you need to ask those questions to your doctor. The information that Dr. Don is going to be sharing tonight is for informational purposes only, even though it is rooted in deep science. Great information. We'll share those links for you to be able to check out the science yourself. Just know that we're not making any claims to treat, cure, prevent any type of disease or condition or anything. So with that being said, I want to give you a little bit of background on Dr. Don. So he is a graduate of the University of Michigan and Wayne State Medical School, where he graduated with his MD degree. I'll let him tell you how many, just a few years ago that was. It's been just a minute. Dr. Don has been the chief science officer for several wellness companies over the last 40 years, where he has formulated and consulted on many different health projects. And of course, that's how I met Dr. Don. He was the formulator and the chief science officer educating with a company that I worked with years ago. Dr. Don is the author of 5 books. We'll make sure you get that information in the chat later as well. And hosted a wellness TV program with his wife, Susan, for 10 years on the TCT Global Network. He's a licensed ordained minister who has taught on Bible health for the last 25 years. Dr. Don also writes and produces music and loves to share his music and bring joy to many people. And I can attest to that as well. We travel the world together, and he travels with that guitar, and we love hearing him sing and play music and bring our community together in that way. So Dr. Don, thank you for being here this evening. We would love for you to share a little bit about your background, your passion, and why you decided to take a look at LifeWave. Reluctantly, we know. But for our new listeners here, give us your story, give us all the information, and of course, tell us how this technology works.
Okay, well, thank you, Dr. Stacy, and welcome everyone. It is truly my high honor to be with you tonight and to be able to talk with you about the most successful thing I've ever used in my practice. I actually practice naturopathy, which is using natural alternatives to help people get off pharmaceuticals when they can. It's not always reasonable or prudent or even advisable to do that, but often it is. And there are natural alternatives for most pharmaceuticals, which are a poison with a desirable side effect. And I say that tongue in cheek, but I think there's a better way than poisoning yourself to health in the long run. I've been doing that for 40 years as an MD and mostly teaching people how to detoxify their body, how to balance their immune system. In the process of doing that, I've worked with many natural modalities, but nothing like this patch. And frankly, when I first heard about it, I was not at all excited about it. I didn't believe in it at all. My wife shared it with me because some friends were having fabulous results. These were close friends of ours who had struggled with carpal tunnel syndrome and then blood pressure issues for many years, and this helped it. So she was excited. She had seen some of the before and after pictures, and she said, I want to get these patches. And I said, Susan, I am not going to tell people to put a patch on their neck and it'll heal them. I was born at night, but not last night. I wasn't the least interested. But actually, in order to prove to her that there was no science behind it, I looked into it because she said there were studies. And I'm like, okay, I've seen natural alternative companies with studies before. A lot of times they do the studies and they might do 10 studies and one is favorable and the other nine are not, and you never see the other nine, and that's not good science. What I saw here was completely different than that. It was rock solid science. In fact, these studies were like I was used to looking at in medical school. They were double blind and placebo controlled. They were independent, not done by the company, but done by other places. Some of them done at the #2 stem cell research facility in the world, the University of Ireland. That was very impressive to me. That got my attention. But most importantly, many of these studies were peer reviewed. That means you do your study, you make a conclusion, and then you invite your colleagues to look at your study and see if they agree or if there's anything wrong with the study. So these were valid studies, and there were many of them, over 50 of them at that time. I think there's over 80 studies on this science of photobiomodulation, which is simply photo, light, bio, the body, modulation, changing the body with light. And this is simply wearable light therapy. If you've not seen this patch before, it's just about the size of a quarter. You simply peel it off, put it on your body, wear it for 12 hours of activation, and then you take it off and throw it away. It's basically used up. There's about enough media left in the patch for a dog or cat, and it will work on your pets. And then you stay off for 12 hours of rest and restoration. Then you repeat the process 7 days a week. Now, it's not dangerous to leave the patch on more than 12 hours. However, we want the body to not get acclimated to it, so you get 100% benefit when you put that next patch on. And that's why we recommend, I tell people, when you're brushing your teeth in the morning, put your patches on, set an alarm on your phone because you think you'll remember, but you won't always remember. Sometimes I don't even remember, and I've been patching for almost 3 years now. So that's how you use it. That's what you do. So when I looked at it, uh, these studies that I saw were just amazing. One study that I saw was this. Every 6 weeks, you wear the X39, which is our flagship master cell rejuvenating patch. And I'll explain what I mean by that specifically in a minute. Every 6 weeks, you wear that patch, reverse ages your cardiovascular system. That's your heart and your blood vessels by 8 weeks. That was a stop me in my tracks right there, because I thought if anything could do this, everybody in the world would be trying to get it and want to use it. And in fact, that is the case. This company is the #1 growing company of its kind in the world for the last 4 years, and for good reason. But we're just skimming the surface of letting the world know about it. Thankfully, you don't have to have a prescription to use it, and it doesn't cost 10 or 20 times as much as it does, which it probably would have going through the traditional medical challenges. But I'm very thankful that David Schmidt, our inventor, who's definitely the wisest man I've ever met, and I've met a lot of wise people in my years of doing what I'm doing, he chose to bring it to the people. And today there are literally thousands of MDs like myself, DOs, chiropractors, naturopaths, massage therapists, and just people, millions of people using it worldwide. We're in several countries, I think over 80 countries now. So the patches are not on trial. The patches, they work. There's tremendous results. But how do they work? Well, when I first read the studies, then I got excited about it, using it. But my #1 concern was, is it safe? And I'm sure you're concerned with that. And that question was answered very easily because this patch is non-transdermal. What does that mean, non-transdermal? I didn't even know at the time when I first studied it. The patches I was familiar with were like nicotine patches for stopping smoking, or an estrogen patch for hormone balancing, where you have the chemicals in the patch, you put them on your body, and the chemicals go in and do their work. There are no chemicals from this patch entering your body, which is very exciting from a safety standpoint. Uh, so you don't have to worry about interfering with pharmaceuticals. It will not. You can be on many pharmaceuticals. You can be using over-the-counter medications, vitamins, minerals, herbs. Won't interfere because it's non-chemical. But then the question comes, how does it work? Well, it works with a very unique process, It works with your body. Our bodies are fearfully and wonderfully made. The normal thing is to stay healthy. We have 100 trillion cells, and at any given time, there's literally thousands of things going wrong in those cells, uh, probably more than thousands. But you have an autocorrect system built in your body, including the immune system and many other systems that are constantly and consistently correcting those errors, keeping you in a healthy state. The balance between anabolism, building your body up, and catabolism, tearing your body down, which is a constant state while you're alive. So your body wants to bring you to this normal balance, homeostasis, a healthy state. And what happens with the patch is you put the patch on and it uses your body's heat, your 98.6, your temperature, which is infrared energy, to form a very specific wavelength of light. When your body's heat, your 98.6, unless you're hypothyroid, you might be 96.6, but that's still plenty of heat energy, infrared, to hit the patch media, which in this patch is organic amino acids in a microcrystalline stereoisomer. And it just so happens when infrared energy, heat energy, hits that structure, it makes light, a very specific wavelength of light. In the case of this X39 patch, the master cell rejuvenator, and that is reflected back into your body. And that is what does the work of restoring and renewing these master cells. Now, what do I mean by master cells? What are these master rejuvenating cells? They are cells that can become anything your body needs. Boy, that's an interesting concept. Do you need help in your liver? They can become a liver cell. Do you need help in your kidneys, your skin, bone, whatever it might be, muscle? These cells, a nerve cell, a brain cell, these regenerating cells can become new cells. And it's how your body restores and renews itself constantly throughout your whole life. Now, what most people don't know is this, and it's very important to understand this. And really, all you have to do is understand these two facts to get started patching, certainly, but also to share with others is the fact that you have these rejuvenating cells. But by the time you are 35, you have lost 50% of the activity of these master rejuvenating cells. And by the time you're 65, you have lost 90% of the activity of these cells. And it's consistent with what we call aging in our body. It's why we don't rejuvenate our body like we used to. We don't heal up as fast, and we don't uh, rebound from things that we've had when we were younger. Why? Because we don't have the number and activity of these master rejuvenating cells. And I love your example of that, Dr. Stacy, when I first started learning from you about this, how you used the example of a 10-year-old. A 10-year-old child is filled with these rejuvenating cells. They don't have chronic back problems and chronic degenerative diseases, the diseases of aging, the cancers, the heart disease, the diabetes, the arthritis. Uh, they don't break a bone when they fall off that bike. They hop back up and get on it. If they cut their skin 3 days later, you can't even see where the cut was. Why? Because they are loaded with these master regenerating cells. So how would you like to turn back the hands of time, which is literally what we're doing with this technology? It is the reverse science of the future, the reverse aging science of the future, and I believe the preventative medicine of the future. And of course, we don't make medical claims for the patches, and we don't diagnose or treat sickness and disease, but we do support the body's ability to do just that. And your body can do that. Our role is to help keep our bodies in a condition where it can do that most effectively. Dr. Stacy mentioned that I've written several books, and I have one of them I have here with me, Do This and Live Healthy. It's on Amazon. And this book, I teach 10 keys, which all my books teach these 10 keys. They're foundational issues for your health. and they're very important. They're not the only things about getting and staying healthy, but they're very important. And I've turned it into a little song to help you remember it, which goes like this. Learn to relax, get to bed on time, and do your exercise. Breathe fresh air when the sun's out there, and eat like this little rhyme. Fruits and vegetables, whole grains, white if you choose meat. Drink what you're mostly made of. Water makes your health complete. I know that's simple. I know it's elementary, but it's foundational for your health. And your health is your choice. And your health is very simple. All of these things are extremely important. Like drink what you're mostly made of, water. Hydration is so important. A lot of people aren't sick. They're just thirsty. They're treating dehydration with medications. But it turns out that it's very important to stay hydrated when you're using the patches. Now, they'll help the patches work even better in a hydrated individual. That's why I recommend people drink half of their weight in pounds in ounces of water every day. But if you're not doing that and you are dehydrated, the patches will still work. In fact, that's a more important reason to be patching because you're neglecting one of those major keys. Just like exercise. When you move your body consistently, even just a 30-minute walk 5 days a week, you move immune fluids through your body 3 to 5 times in a 24-hour period versus a sedentary person where it may take up to 24 hours to move those same fluids. So you get 3 to 5 times healthier just by moving. Move it and you'll improve it, I teach people. Same thing goes for that. Patches will work better if you're moving your body. They'll work if you're not an exerciser, and you need patches more if you're not an exerciser. So don't neglect these 10 foundational keys. And the patches are not meant to replace any of those. They're meant to work with it. The patches are another tool in your tool belt to help you live long and strong. So that's what they do. So now let's talk a little bit more about what happens when you put the patch on and how it actually does its job. Even though that sounds very futuristic, light therapy, it's creating light that's going in my body, and how that sounds really futuristic. Well, it is in a way, but the process, the function of that happening in your body is ancient. It's as old as life itself, and humans are going out into the sun and letting the sunlight hit your skin and make vitamin D. That is photobiomodulation. That is changing your body with light. But in the case of the light of the sun, it's the whole spectrum of light, and it's very far away, so it's a low intensity. What we've done is taken this process, this physiologic process, and made it very specific, a very specific wavelength of light, which is what makes one patch different than another, the very wavelength of light that it's using. In the case of the rejuvenating cell patch, it forms, it enhances a signaling molecule in your body called GHK copper peptide, which is well researched, been known for since the 70s, and known to increase and enhance this master cell rejuvenation in your body. So that's how it's working. It is definitely safe. What happens when you put this patch on? Well, among other things, I love to share this because it's a whole nother modality, really. Within 24 hours of putting your very first X39 master cell rejuvenating patch on, you are communicating with 4,100 of your 18,000 genes to express at a healthier, more youthful level. You say, what? It's working at a genetic level? Yes, it is. In the days of us thinking that if you have a bad gene that you're going to get the disease it causes, or if you don't have it, you're not going to get it, those days are over. Just because you have a gene doesn't mean anything. It's whether or not that gene is expressed. And I like to simplify it and teach people this, which is absolutely true, that genetics loads the gun, but lifestyle pulls the trigger. One of the greatest lifestyle things you can do to pull the trigger on good genes and keep the trigger from being pulled on bad genes is putting that X39 master cell rejuvenating patch on. Within 24 hours, it's doing that, and it will continue to do it as long as you're wearing the patches. But that's not all that happens. What have I experienced with literally hundreds of people now personally in about a 3-year period? I'd say it takes about 3 to 6 weeks for 80% of people to notice something when they're patching. That doesn't mean that it's not happening before that. It's happening as I described immediately. But about 80% of people will notice it within 3 to 6 weeks. And I've had probably most commonly energy and sleeping better. Those are two that are just very consistent across the board. What else? Pain, less pain and inflammation, clearer, more focused thinking, skin changes, improved wound healing, better recovery after exercise, also very common. GI changes. I think sometimes tissues that turn over more quickly in your body may respond more quickly. It's not always the case. There's a lot of other factors, but you get new skin every 28 to 45 days. You get a new liver every 6 weeks. So things can happen very quickly there. You get new cells lining your stomach in the GI tract every 3 to 5 days. So sometimes we see quicker results with those kinds of situations. But it's going to take, for 80% of people, about 3 to 6 weeks. 10% of people will be quicker than that. We call them one patch wonders, might be one day, a few days, a week, or a couple of weeks. And that's wonderful, but I don't tell people to necessarily expect that because that's the minority, not the majority of people. And then on the other end of the bell curve, there's 10% of people that will take up to a month for every decade of life. Like for me, I'm 68. That means I've lived 6 decades. I'm in my seventh. I need to wear these patches for 7 months before I can necessarily see if it's doing anything in my body. Because even though I don't feel something, we know what it's happening scientifically. We can measure that. That doesn't mean that it's not happening. Just like you don't feel your blood pressure change or your blood sugar change, but both of them have, even since you've been listening to me. So to me, the biggest challenge, or I really should say educational opportunity, or that's what the challenge is overcome with in sharing these patches with people, is letting them realistically know it can take a couple months. You need to make at least a couple month commitment to wearing these patches to really get the full benefit. And then I always start people on a second patch. Using those two together, we call them the dynamic duo, the X39 rejuvenating patch. But the second patch is the EON patch, AEON. And that patch is to decrease inflammation. And that used to be the most popular patch before the Master Rejuvenating Cell patch came on about 4 years ago. And for good reason. It's good to keep inflammation down just for everybody because inflammation is a cause or promoter of every kind of disease, including the big enemies, the cancer, heart disease, diabetes, arthritis. Inflammation is a major factor there. So it's good just to keep it down. We eat an inflammatory diet for that purpose, or that's what I recommend. So that's important, but it's particularly important when you're waking up these master rejuvenating cells because this patch technology is smart technology. What does that mean? It means it works with your body to go after the most important thing that's going on in your body first. Then when it's solved that problem, it goes to the next one, and the next one. Because there are thousands of crises going on, as I mentioned earlier. Many things are happening in your body right now that are potentially terrible and life-threatening, but you'll never find out about them, which is great. That's the natural thing. But as we get older, some of those our body can't keep up with. That's what turning back the hands of time with this natural wearable light therapy can help us do. Turn back so we can more efficiently promote the body's ability to fight sickness and disease. So we let people know, but it is smart technology. Makes my job a lot easier as a physician. I don't even have to figure out what's wrong. I just need to get people patching. And that's my one important plea to you tonight, no matter what situation you're in. If you've seen or heard this before, you've never heard it before, get some patches, at least get the X39 and EON, get them on, get into that 2 month or 3 to 6 week period and let your body tell you what's happening. I mean, the testimonies that we have are just phenomenal. Personally, I wore the patch for about first 5 weeks diligently, and during that period of time, my wife had some. It was miraculous to us response to it. She had a shoulder rotator cuff injury, so she couldn't go to exercise classes like she liked to. And it went away, and she could go and lift the weights. And so she was all excited about that. And then, even more, plantar fasciitis, which she struggled with for 10 years. She wore a brace on her ankle every night to be able to tolerate it. And that went away. She hasn't worn that brace in 3 years now. It's completely gone. But 5 weeks in, I said, Susan, I don't think these patches are doing anything to me. And she said, well, you're not getting up 2 or 3 times at night to use the restroom and waking me up. And I didn't connect that, but that was true. You don't miss doing that. But when you get to be my age, a lot of men in their 40s or 50s, even, let alone late 60s, like I am, have that experience. And I have not had to do that uh, since I've been patching for 3 years. And even if I don't restrict fluids before bed, which I always had to do before, and I was still getting up. So it definitely had a powerful effect on my prostate. But that's not the most important results that I've gotten from this. Personally, I got my best results from month 9 to 12. And of course, I'm not 90 to 120 years old, but I'm glad I kept wearing the X39 and the Eon, because in months 9 to 12, I experienced a brain balancing where I've struggled with clinical depression for 30 years. And for the last 2 years, I have not experienced that, and it was like clockwork with me, and it has been wonderful. So you, even if you wear your patches, and I hope you do, for the 1 month for every decade of life, don't stop wearing them. You could, and you won't lose any of the gains you've gotten, but you will go back to aging the way that you did before that. So that's been life changing for us. So number one, they're safe. They are definitely effective with all these clinical studies. The patches aren't on trial. What's on trial is if you wear them consistently. And then, most importantly, they are affordable. The stem cell therapy that I was familiar with before I heard about this was where we took bone marrow or fatty tissue and concentrated our old worn out stem cells and injected them into people. And we're getting some success with that. I liked it because it was natural and it worked sometimes, but it was limited to local situations, wouldn't work for systemic problems. So this is wholly different. And that costs 10, 20, $30,000 for one round of the treatment. And you sometimes have to go out of the country to get that. So this is uh, extremely affordable, just a few dollars a day for the X39 wholesale, and then $2 a day for Eon. I recommend it for everyone. It has been the most life-changing and most successful thing that I've shared with people ever in 40 years of being a physician. So that's my story. I recommend people get on the patches, start patching first of all, and then go to the website and start learning about it. You can dig in. All the studies are available. The patent, 20-year global patent that we have on this product. So, Dr. Stacy, I'll turn it back to you with that.
Well, thank you so much, Dr. Don. Wow. I am just so grateful. You are amazing. You have just such a perfect way of explaining this technology so everyone can understand. It blows me away every time I hear you. I'm so grateful for you taking the time to pour into our community this evening and to help so many people, of course, that are going to be listening to this replay and sharing this. So thank you for your expertise, your knowledge, your information, and your heart. So grateful for you. Thank you, thank you, thank you.
My pleasure. Thank you.
I look forward to seeing you on Zoom again very soon.
All right.
Have a fantastic evening, everyone. Thank you.
God bless. Bye bye.